So I'll just start with the presentation. Am I audible?
Yes, ma'am, you are audible. We can hear you.
The presentation?
Yes, ma'am.
Perfect. So yeah, here it's afternoon in India and I'm from Delhi. I'm a yogic. I started with one of my project, which is yogic roots. And here I would like to thank the Scientex one to give me this opportunity. And I would like to present my paper, which is on the correlation functional anatomy of hip musculature with yogic postures. So how we all know that it's so important, the gluteal muscles, right? Our hip, which has 3 muscles, and how they are connected with asanas. So my listeners will be able to enumerate gluteal muscle, types of gluteal muscles. We will also understand in the process the significant role pelvic stability contributes to maintaining the desired alignment in yoga asanas. There are many yoga asanas which definitely needs the activation of our gluteal muscles. Okay, like we'll see in the process how, the Pavan Muktasana, how warrior pose helps us in stability. We will also correlate the essential role of pelvic stability in the health of our lumbar spine, sacrum, hip joints, and knees. Definitely, our hip muscles does not only give us the stability, but they are kind of base which divides our trunk as well as the lower limbs. So we'll know how the hip is very important in minimizing a lot of injuries also and decrease these injuries and the frequency of the injuries. I'll also like to propose the injury prevention techniques for various disorders which happens due to long sitting hours. Okay, nowadays we all know that we are sitting for a lot of time. We are doing webinars and we are listening to people. Definitely I would like that we should always stretch and give ourselves some nice practices, some nice yoga asanas, which we will see. Just so that our psoas muscles and our hip musculature stay healthy. So first, when we talk about the gluteal muscles, that is the glutes, it is made up of the gluteus maximus, medius, and minimus, which make us our buttock. Glutes is the nickname we give to the 3 sets gluteal muscles that originate from the pelvis and insert into the femur. So that's why I told that it becomes the division between the trunk and the lower limbs. So glutes are involved in almost all the activities. It helps us to walk, it helps us to stand, to squat. So hip extension, abduction and rotation, moving from squatting to standing, stabilizing the knees, stabilizing the hips, pelvis and lower back. Everything is definitely done by the glutes. And also when we talk about here gluteal muscles and lower back, it's very important to know that, most of the people nowadays complain about lower back issues. So it's not just the practices like Surya Namaskars, that is sun salutation that we do, but we also try to activate the gluteal muscles to, minimize the lower back pain. So understanding gluteal muscles definitely help us to reduce the lower back pain. First, as I told, it's 3 muscles which combine together to make the gluteal, the buttocks. The first is the gluteal maximus, where it originates from the gluteal surface of ilium and insert to the greater and the lesser trochanter. Then comes the gluteus maximus is the biggest and the most buff of the gluteal muscle. Definitely, it gives the shape to our hip. It's actually one of the strongest muscles in the body, working alongside its smaller companions to establish the pelvis and participate in hip rotation. It plays a principal role not only in the abduction and lateral rotation of the hips, but also in hip extension, which pulls the leg backward as we do in Warrior 3. Ultimately, having strong gluteal muscles contributes to improved balance, posture, and pelvic stability. In combination with a strong core, the increased pelvic stability granted by the glutes can help reduce the risk of a range of sports-related lower body injuries, that is the hamstring strains. So many a times, our glutes combined with the core stability, when we make our core strong, our pelvis stability increases, and many injuries which are generally, related to sports are also reduced because they also helps our hamstring to become strong. So this is this we can see in the picture, gluteus maximus, how in warrior 3 we activate our gluteus maximus, and then the Setubandhasan, how again when we lift our hip up and we focus on our tailbone, again the gluteus maximus is activated. Gluteus minimus is also one of the deepest one. The minimus is the smallest and the deepest of gluteal muscles. Its job is to abduct the thigh and stabilize the hips, pelvis during walking, running, and standing on one leg. In addition, its anterior portion provides internal rotation to the thigh, while its posterior portion provides external rotation to the thigh. It does makes a lot of difference in asanas, but being smallest and deepest, we cannot really coordinate, and we cannot really correlate ourselves with minimus, but getting activation of maximus and medius is the most. That's why we'll talk about gluteus medius now. Gluteal surface of ilium is the origin part, and lateral aspect of greater trochanter of femur is the insertion. When we talk about gluteus medius, it's a fan-shaped muscle sandwiched between the maximus and the minimus. It is located on the side of our hip, and it's a key muscle which keeps and maintains the health of our back because it is connected with the psoas also. It is the principal mover in hip abduction, lateral rotation, and medial rotation. It maintains the side-to-side stability of pelvis, aiding the gluteus minimus in keeping the pelvis properly aligned during movement and single leg balancing, like in Vrikshasana, the tree pose. Most therapeutic or corrective exercise programs aimed at relieving low back pain. So when we talk about lower back pain and relieving, we definitely include tree pose in our strengthening practice. And there are a lot of stretching practices also which surround the hip joint, including the gluteus medius. This is because hip joint is key for body stability and locomotion. When we talk about, now let's go to the second part, when we talk about the weakness of our gluteal muscles and the possible injuries. Many a time, because of tight hamstrings, many people try to get into asanas like Paschimottanasana and get many injuries due to faulty posture and sedentary lifestyle. Again, due to long sitting hours, we forget to activate our gluteal muscles, and over time, these muscles become weak. As we always say that, human beings are also like machine only, and we need to keep ourselves active, to keep all the muscles active and to keep our body active. To begin to correct these lower crossed imbalances. So we'll see in further slides that how when our body is not balanced, the disbalance leads to the lower crossed imbalance. Okay, so kind of when you see people walking, the hips are not aligned, rather one will be slightly lower and the other will be slightly upper. So we can definitely have a lot of yoga asanas which help here, like Pavan Muktasana, which is a knee to chest. So when we lift one of the knee to the chest, this is Pavan Muktasana. And it also includes abdominal stretching poses like the plank, and then gluteal strengthening like the Utkatasana, which is a chair pose. So these three asanas, like as I told, Pavan Muktasana, plank, and Utkatasana, that is the chair pose, definitely helps and releases our gluteal muscles. And after long sitting hours, we should definitely do some of these practices so that we can keep our muscles in health. After weakness, there is also another concept, which is the tightness. Okay, the tightness again comes when we do not use them a lot, and different kind of injuries are occurs due to the tightness. Due to tightness, it limits the forward bending, and the weakness limits the back bend. So if you want your spine to be really healthy, you should be Forward bending should happen, the back bend should happen. Take care of your gluteal muscles. Weak hip musculature is commonly associated with a disruption in the joint loading pattern. Again, as I told you that when it becomes weak, the joint loading pattern disturbs and the imbalance occurs, which brings lot of problems in our ankle, in ACL, in patellofemoral pain syndrome happens. Furthermore, people with gluteus medius weakness have more chronic lower back pain, definitely, and increased abduction and internal rotation is also being hampered. So here, when we did some of the research where we kept the objective as to activate and strengthen weak glutes. It brings awareness to muscular imbalances in the hips and pelvis and train effective movement patterns. Gluteus maximus strengthening combined with core muscle strengthening and lumbar flexibility can be an effective way to prevent the lower back pain. Here I have also portrayed some of the pictures which can commonly be done, like the table pose, the tiger pose, again the warrior pose. But when we did our testing on females and males, we found that when we did the studies on tree pose, warrior 2 pose, warrior 3 pose, half moon pose, and bird dog pose. These are these 5 asanas where we tested our participants, and with the test, we found that warrior 3 pose and half moon pose was the most, it came into our hand and it helped us the most. So I'll show the picture again. This is the warrior. This is the half moon pose with the extended leg, and it makes the gluteal muscles most active. And they are further followed by warrior 3 pose. Then it was studied that half moon pose on the lifted back leg followed by warrior 3 pose came to our hand with the most of the activation. And when we talk about Surya Namaskar, that is the sun salutation, Ashwa Sanchalan was the one asana where we found gluteal maximus as most activated one. So a significant difference in gluteal medius activity was found between males and females and between experienced and inexperienced subjects, indicating more gluteus medius activation among males than females and more activation among inexperienced versus the experienced one. Thus, I would like to conclude here that yoga asanas and the hip musculatures definitely come in our hand to help our tight and weak muscles. Many asanas like Utkatasana can strengthen our gluteal muscles and correct our faulty postures. Thank you.